Hello, I'm Dr. Ellen Ap-Thomas. I'm often asked, what is lymphedema and how does it affect the body? Lymphedema is a common disease which can never be cured, and if it is not treated, it gradually worsens over time, and symptoms such as heavy, swollen or sometimes painful limbs and recurrent bacterial and fungal skin infections may appear. This ongoing condition occurs when the lymphatic system does not function and is unable to effectively remove substances made in the tissues. This results in persistent swelling of the affected parts of the body. Lymphedema can be broken down into two main groups, primary and secondary. In primary lymphedema, lymphatics do not function properly from birth. These vessels become dilated and do not pump efficiently. Secondary lymphedema can occur if the lymphatic system is blocked or cut from either surgery, radiotherapy, an accident, parasite infection, or paralysis of a limb. Chronic venous insufficiency, or lipedema, add to the problem. The lymphatic system is closely linked with the other important network, the vascular system, or bloodstream, and transports fluids around the body. Specifically, it collects and carries excess fluid, lymph, and other waste material from body cells, filters out larger particles such as bacteria, and then delivers the fluid back into the bloodstream. Hence, it has a very important role in maintaining metabolic balance in the fluids which surround the body cells and helps protect the body from disease. If the lymphatic system is damaged or blocked, protein continues to enter the tissues from the blood capillaries in the normal way, and a build-up occurs in the tissues, which the lymphatics should be draining. The accumulation of protein in the tissues causes excess fluid to enter them and the tissues to swell. The swelling decreases the ability to transport fresh blood and nutrients. This then reduces the oxygenation of the tissues, interfering with their normal functioning and reducing their healing rate. Some protein is also removed by cells called macrophages. These cells assist the lymphatic system and can partly take over its role if it is blocked. However, the excess of protein accumulation in a lymphedema sufferer causes these cells to also cease functioning. Most people assume lymphedema only occurs in the arms or legs, but any organ or region may suffer from it, such as the genitals, the gut, the lungs, or even the liver. Lymphedema symptoms vary, and sufferers may experience feelings of tightness and heaviness in the limbs, bursting type pains, aching buttocks with leg lymphedema, or back of the shoulder pains with arm lymphedema, pins and needles, or pain in joints similar to arthritis. Other symptoms may be tenderness in the groin of an affected leg, and affected areas feel warmer than other parts. It also has a number of other effects, such as decreased mobility. The person is more likely to suffer depression, and if the lymphedema is severe, the patient may become excessively heavy in body weight. Those affected by this condition are also more prone to bacterial skin infections, which may sometimes require hospitalisation. There are 3 grades of swelling with lymphedema, and if the condition progresses for some years, the swelling gets worse and skin changes occur. There is loss of hair and alterations to the nails. With grade 1 swelling, the skin will pit if it is pressed and will reduce if the limb is elevated. Grade 2 has more excess fibrous tissue, doesn't pit and won't reduce much with elevation. And grade 3 is elephantiasis, which has gross changes to the skin, many protrusions and unsightly bulges. Once lymphedema has developed, there are no treatment miracles. Thus, prevention through early detection and risk minimisation is crucial. Diagnosis of lymphedema is usually very simple. It may, however, prove difficult if 2 conditions exist together. Lymphoscintigraphy is still the best and safest means we have of measuring lymphatic function and gives a fair image of the system. Treatment options are aimed at either reducing the amount of lymph produced or increasing its transport. The major strategies for reducing the lymph produced is by improving the structural integrity of the vascular system, reducing hypertension, improving cardiac function, improving skin integrity as a barrier, encouraging better wound care and rapidly responding to infection, reducing body mass and using support garments. Strategies for increasing lymph transport are aimed at either increasing lymphatic flow or at encouraging the formation and development of new lymph vessels. Strategies that increase lymph flow are aimed at increasing the entry of extracellular fluids and materials into the lymph capillaries and improving the flow of lymph along the larger lymph collectors. The higher the load into a lymph collector, the more forcefully it will contract. So getting the fluids into them, even if they are not totally functional, is important. The most current treatments for symptoms consist of medications such as benzopyrones, compression bandaging and garments, compression pumps, low-fat diets, elevation of the limbs, hydrotherapy, laser and massage. There are also many other experimental treatments, though few have actually undergone quality control trials. So how can Niagara Therapy's cycloidal vibration help? One of the best in-home treatments for lymphedema is massage pads. The only one that has been clinically trialled and proven to improve lymphedema by Australia's own Professor Neil Pillar and his medical research team at Flinders University is the Niagara Cyclopad. The vibration of the pad helps vary tissue pressures and helps move lymph fluids and their contents into the lymphatic system. It has been clinically proven, as well as improving the lymphedema, to also ease the symptoms, improving range of movement of the affected limb, enhanced ability to exercise. Patients found it easier to walk stairs, noticed improved sleep, and felt less conscious about their condition after only 3 weeks of using the massage pad. And hence Niagara offers lymphedema sufferers an improvement in their quality of life and provides a sense of control over their condition, which is very important. It is crucial for those suffering with lymphedema to take good care of their skin. Most people affected have dry, scaly skin with increased fragility. It is important that skin is well protected and remains in good condition to act as a barrier against invading infection. Due to the low acceleration rate of vibration of the Niagara massage equipment, it has been shown to be safe for use on fragile tissues without causing disruption to the compromised skin integrity. Niagara is easy to use in the home and does not require specialised professional training or supervision to operate. It is safe when used as recommended, and there are no risks of creating harmful effects, as with other treatments for lymphedema, such as poorly fitted compression bandages or garments, which may exert a tourniquet effect. The use of cycloidal therapy on sufferers of lymphedema will ensure that compression bandages work more effectively, and the likelihood for the need of antibiotics will be reduced due to improved circulation. Using Niagara products will help to improve a sufferer's feeling of well-being. It will help to encourage them to increase their physical activity and, in feeling better, make wiser food choices, which has been shown to improve the outcome and progression of lymphedema.